Hi, I'm Eti Ben Shabbat from Brain Rehabilitation, and this is the second video in a series of 5 videos where I explain how to get a copy of your brain scans and why it's important to do so. In the previous video, I touched on why it is important to have a copy of your brain images, but let me expand on this a little further. As I mentioned in the previous video, when you go for a brain scan, you end up with the brain images, the brain pictures that the radiographer took, and with the report that the radiologist wrote. Both of them will be stored in the medical records where you had your scans, where you had your brain scan. And that might be a hospital or a health service or a radiology service. It doesn't matter where it is. The point is that let's just call it Health Service A. So Health Service A will share reports of brain scans with other health services or other health professionals, but not brain images. And there's 2 reasons for that. Health services have different systems for storing their brain images. So, for example, health professionals in Health Service B won't be able to access the brain images stored in Health Service A. The second reason is related to legislation around health information and privacy of health information. And this legislation prevents anyone who doesn't work in Health Service A from getting the brain images that are stored in Health Service A. The other side of the coin, and that's the other side of this legislation, is that you as an individual have the right to have a copy of your brain images, of your own brain images. Now, this is important because if you have a copy of your brain images, then you are free to show it to any health professionals who treats you and can benefit from seeing them, regardless of which health service they work in. It's true that not all health professionals would like to see the brain images. Some find the radiologist report quite sufficient. But at least if you have a copy of those brain images, you have the freedom to show them to whoever may benefit from it. So my message is that you have the right to have a copy of your brain images. And if you do have a copy of your brain images, you also have the freedom to choose who you share them with. So my 3 pieces of advice are: 1, exercise your right to have a copy of your brain images, not just the report. 2, share your brain images wisely rather than freely. So share them with people who can benefit you and treat you better. And the 3rd is store them safely because you never know when you're going to need them again. I hope you find this information useful, and please like and share the wisdom with others, and I look forward to seeing you in my next video. Bye.